Hi, this is Dr. A with your Intro to U.S. Healthcare lesson, and we're going to continue Chapter 7 on long-term care services, and this is from Basics of the U.S. Healthcare System from Nancy Niles, and we're going to look at current trends in long-term care services. So the first current trend is continuing care retirement communities. These communities combine independent living, assisted living, and nursing care on one campus. So independent living has the most independence, and then you have assisted living, and then you have nursing care. And they have it all in the same facilities in different areas. And this is what we call an aging in place model. It offers the opportunity to reside in a single-family home or in a little apartment. And then as residents age, they can be transferred to an assisted living facility and eventually to a skilled nursing facility. There are some rules, though. Seniors must move into a continuing care retirement community when they are healthy and they can live independently. So they need to enter it on the independent living side of things. There are 4 different categories of life care contracts that you can sign within continued CCRC. You have the extensive contract that include housing, residential services, all the amenities, so all the different things that are on the campus, and also unlimited access to health care at a budgeted monthly rate. So you can, access healthcare, physician, whatever, on site, again, for a certain rate, which is going to be the most expensive contract. Then, going down in expenses from there, you have a modified contract. So you have the housing, residential services, and the amenities, but limited healthcare access. And then you have the fee-for-service contract. So that has housing, residential services, and amenities, but no healthcare services are provided. Sorry. And then the rental agreement contract is a monthly or annual basis contract, and it does not give the resident access to healthcare services, and probably has more limited amenities and services and things like that. So again, that would be from the most expensive to the cheapest. So this is really cool. You have to look these up look them up on YouTube, but the Greenhouse Project is really awesome. So in 2001, the Robert Wood Johnson Foundation funded a pilot project developed by Dr. Bill Thomas, and it's called the Greenhouse Project. So it is a unique type of nursing home that focuses on creating a residence that not only provides services, but is also a home to the resident. And it looks like a home, and it feels like a home to them, and not a sterile institution, and they can receive care in that home, which becomes their home. And so the typical greenhouse maybe houses 10 to 12 residents. So again, it's a small version, a small institution, and basically they all become roommates. They can each have their own room, but there's like a common dining area and kitchen, and etc. And it feels like you're kind of like living in a fraternity house, a sorority house, just with senior people, and they have staff on site to take care of them, to help them with what they need. So they are managed by a team of workers who share the care of the residents. They do the cooking and the housekeeping. The daily staff members are certified nursing assistants. And then there's also, some more healthcare professionals in the team. So there are physicians that will pop in and check on them, nurses, social workers, dietitians, and they form these visiting clinical support teams, and they can assess the residents and supervise their care. Now, they may the visiting clinical support team just visits the home. They don't stay there all the time. The CNAs are there like constantly, right? So the first greenhouse was constructed in Tupelo, Mississippi, not too far from where I am. And they are now, in 2011, they were saying there were more than 100 homes in nearly 20 states. I looked up the more up-to-date statistics, and since it started in 2001, so more than 20 years ago. There are now 359 homes that have been built in more than 32 states, with more on the way. It is a great model. They also noticed that when the pandemic hit nursing homes in 2020, the elders and staff in the greenhouse homes fared significantly better than their counterparts in nursing homes. Another trend that started also in 2001 in Boston, Massachusetts, a group formed a nonprofit called a Beacon Hill Village. So this is the village movement. And so what they did is they formed a network of service providers to provide services to older homeowners that allow them to remain in their homes and maintain their independence. So the network typically acts as a liaison to connect homeowners to needed workers. And this can be things for simple little house repairs or plumbing work or yard work, mowing, or Meals on Wheels, or different things like transportation services, all other things. But it was a network of community-based services to help the people stay in their home. The membership to the organization cost annually about $600, and that opened up to a network of contractors and volunteers who offer services that would typically be offered in a retirement community, without, of course, the cost of being in a retirement community. So there are now nearly 200 villages nationwide and more in development. So these are some trends, and so I do want you to explore. There are some other trends all over the world. People are getting creative with what they're doing to take care of the elderly. It's fun to go see the latest ones, but those are the ones in the U.S. that we just talked about. This long-term care service can assist individuals and their families with research into different types of long-term care. And so these are, this type of service, so you can hire this type of service to look at all of these, evaluate all of these options. There are options that are provided by the state. You can look at reviewing financial support for long-term care services, what you might be eligible for, etc. You can research the types of long-term care facilities that are available in your local area, and they can be assisted with selecting, finding the transition to a long-term care provider. Decide, do you want to do in-home? Do you want to do assisted living? Do you want to do nursing skill? How much money you have? What do you qualify for? Can you get Medicare? Can you get Medicaid? Do you have long-term care insurance? Like all of the questions. It's a lot to navigate, and there are professionals that are there to help navigate all of these, and you should definitely take advantage of it. But you should definitely also plan while you're working for your long-term care when you might need it later on in life. So, okay, this wraps up our long-term care chapter, and our next chapter will be on financing.